You know, the human body is full of these absolutely wild biological mysteries. But today, we're diving into one that is fascinating and, honestly, pretty brutal. Welcome to today's Explainer. I want you to really lean in for a second, because we're looking at something that completely defies common sense. We're going to explore what we call the paradox of the aching dead tooth. It's basically a biological true crime story happening right inside the human mouth, where a structure that is entirely lifeless and supposedly feelingless somehow turns into a source of just absolute agony. So, let me pose this fundamental question right out of the gate. How in the world can a completely dead tooth cause you excruciating pain? I mean, think about it. When something in the body dies, the nerves die right along with it. A dead tooth has a necrotic center. The biological wires that are supposed to send pain signals to your brain, they've been completely cut. It should be totally numb. You literally shouldn't be able to feel a thing. And yet, patients with dead teeth report some of the most intense, overwhelming pain imaginable. So, how is that biologically possible? Where is the pain actually coming from if the tooth itself is basically a ghost town? Well, let's dive into this, because right away we find our very first major clue to solving the mystery. The source material points out a really crucial distinction. Yes, the central pulp of the tooth, that soft tissue inside that holds the nerves and blood vessels, is 100% dead. But the environment right outside that tooth, oh, it is very much alive. The pain isn't actually coming from the necrotic pulp on the inside. Those distress signals are being fired off by the living, breathing environment immediately surrounding the root. The tooth itself is really just a hollow shell at this point. The surrounding neighborhood is where the actual riot is taking place. Which brings us to the actual scene of the crime. We're talking about two very specific living anatomical structures, the periodontal ligament and the periapical tissues. Now, the periodontal ligament is this fleshy, living tissue that literally anchors your tooth directly to the bone. And the periapical tissues? Those are the living tissues sitting right at the very tip of the tooth root. These guys are completely vital. They are packed with nerve endings, and they are highly, highly sensitive. When someone talks about the agonizing pain of a dead tooth, what we're really talking about is the pain originating directly from these living structures just outside the root.
So how does this fire actually start? Well, it doesn't just happen overnight. It's a biological chain reaction. First, that dead space inside the tooth becomes the perfect breeding ground for bacteria. Since there's no living immune system left inside the dead pulp to fight them off, the bacteria just multiply like crazy. And then they break out. They exit through the apex, which is this tiny little opening at the very tip of the root. From there, the toxins spill out beyond the canal and right into those living tissues we just talked about. This toxic invasion triggers massive inflammation all around the root tip. Basically, the dead tooth acts like a Trojan horse, unleashing a bacterial invasion directly into the unsuspecting living tissues below. And this is a great way to understand exactly why this specific type of pain is so unbelievably severe. Look, if you have a normal, vital toothache, like say just a cavity in a living tooth, the pain is strictly pulpal. It's confined to the nerve inside the tooth. It hurts for sure, but it's contained. But a necrotic, dead tooth, that involves deep infection and periapical inflammation. The infection has literally escaped the building and set the surrounding biological neighborhood on fire. This deep, widespread inflammation outside the tooth is exactly why the pain feels so profoundly heavy, deep, and often way worse than your run-of-the-mill toothache.
Now here's where we have to talk about the physical environment where all this is going down. Periapical inflammation and the resulting abscesses create pressure. But here's the real kicker. They're creating pressure inside a completely rigid area. Your jawbone is made of solid bone. It doesn't stretch, it does not give way. Normally, if you get inflammation somewhere else in your body, the tissue just kind of expands to accommodate the swelling, right? But deep inside the jawbone, there's literally zero extra room. This pure anatomical lack of space turns the infected root area into a biological pressure cooker.
Let's break down the visceral, physical realities of that pressure cooker. As your immune system starts fighting off the bacterial invasion outside the root tip, pus starts to accumulate, and that fluid takes up precious real estate. As it builds, those living, highly sensitive surrounding tissues are getting heavily, heavily stretched. And because they're trapped inside that rigid bone, they have absolutely nowhere to go. They're basically being crushed against the unyielding walls of your jaw. This intense physical compression of inflamed nerves is exactly what translates into that severe, throbbing agony. It's just pure, inescapable mechanical pressure.
Now, I want you to imagine taking all of that intense, trapped pressure and then physically pushing down on it. Think about the totally relatable, everyday action of just trying to eat a meal. Every single time a patient bites down, that physical force drives the tooth deeper into the socket. And what's sitting at the bottom of that socket?
an already fiercely inflamed, wildly swollen periodontal ligament. So biting down is essentially crushing this battered, swollen tissue between a hard tooth and a hard jawbone. It makes total sense why the source material highlights strong biting pain as a hallmark of this condition. You're localizing the agony with every single chew.
Okay, so we understand the mechanics of the pain now. It's brutal, it's pressure-driven, it makes sense. But that brings us to the final piece of our medical mystery. Why is this intense pain often so difficult to actually locate? You would think that with pain this severe, a patient could just point their finger and say, yep, it's exactly this tooth right here. But a lot of times, they really can't. The signals are completely scrambled. The brain knows there is a massive 5-alarm fire happening, but it gets deeply confused about the exact coordinates of the blaze.
The reason for all this confusion comes down to something called poorly localized, referred pain. Because the inflammation at the root is so incredibly intense, and because the nerve pathways in the human face are so complex and intertwined, the brain essentially misinterprets where the distress signals are coming from. So the actual dead tooth might feel totally fine, but the pain is referred to nearby perfectly healthy teeth, or it might radiate as this deep, agonizing ache throughout the entire jawbone. And incredibly, the source material notes it can even manifest as severe pain in the ear. It is wildly frustrating. The patient is suffering immensely, but the real source of the infection is actively hiding behind a smokescreen of referred pain.
So let's summarize the core paradox we've uncovered in this explainer. The true culprit here, the necrotic, completely dead tooth, is totally silent. I mean, it literally has no nerves left to complain with. But because it acts as a toxic reservoir for bacteria, it forces the surrounding, living tissues to take the painful brunt of the infection. The neighborhood is out there sounding the alarm, taking the damage, the swelling, and that immense pressure, while the actual source of the problem just sits quietly in the center of all the chaos.
Which leaves us with this final, kind of unsettling thought to ponder. The next time you, or maybe someone you know, complains of a mysterious, unexplainable ache in the jawbone, or maybe even what feels like a phantom earache, you kind of have to wonder, right? Could the source of all that misery actually be a silent dead tooth hiding in plain sight, secretly launching a microscopic invasion into the living tissues below? It really just goes to show that in the human body, the loudest alarms don't always come from the source of the fire. Thanks for joining me for this explainer. I hope this helps you look at your own body's mysterious signals in a whole new, fascinating way.